Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors. John Hunter, 1728 to 1793. Hunter's canal, subsartorial canal. Hunter's best-known contribution to technical surgery was his operation of irrigation of the femoral artery in the subsartorial canal for aneurysm of the popliteal artery. This was a common disease in his day, no doubt as the result of repeated pressure from the top of the long riding boot and coachmen and horse riders. Up to Hunter's time, surgeons either refused to operate or tied the artery immediately above the aneurysm, where the vessel was frequently diseased and could easily rupture. Specimens of Hunter's original cases of this disease, as well as the successful outcome of his first irrigation, obtained years later after the patient had died of other causes, can be seen today in the Hunterian Museum of the Royal College of Surgeons in London. John Hunter was the first surgeon to apply the inductive system of observation and experimentation to the study of disease. He also realized that to understand the effects of a disease process, it was first necessary to study the form and function of the healthy individual. John Hunter was born on a farm on the outskirts of Glasgow, the youngest of 10 children. As a boy, he disliked his school lessons, but delighted in natural history, which he studied firsthand in the fields and woods. At the age of 20, John joined his brother William, 10 years his senior, who had established himself in London as a highly popular anatomy teacher, as well as a successful obstetrician. He was later to deliver Queen Charlotte of the future King George IV. John proved to have a brilliant flair for anatomy, worked as William's assistant, and studied surgery under William Cheselden and Percival Pott. In 1760, John joined the army as surgeon and gained considerable experience of war surgery in Portugal and in the campaign at Belle Isle. In 1768 he was appointed surgeon at St. George's Hospital, London. He suffered from angina and died in 1793 at the age of 65 of a heart attack after a particularly aggravating board meeting at his hospital. Among the large number of Hunter's contributions may be listed his studies on descent of the testis. He described and named the gubernaculum testis, his studies of fat absorption by the lacteals of the intestine, his investigations of bone growth, blood supply of the placenta, proof that the seminal vesicles were not, in fact, reservoirs of the sperm, and studies on the grafting of teeth. As the result of his inoculation studies, he wrongly concluded that syphilis and gonorrhea were manifestations of the same disease. An important part of Hunter's contribution to surgery was the way he inspired many of his surgical students to follow his experimental methods. Among them can be listed Benjamin Bell, Henry Klein, Everard Home, who became his brother-in-law, John Abernethy, and, most famous of all, Astley Cooper of Guy's Hospital. Students came to him from America, including Philip Syng-Physick, who is often regarded as the father of American surgery. His monument today is the Hunterian Museum in London, which houses many of his original specimens and preparations. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fahmed.